We use digital payments every single day, tapping our phones, scanning QR codes, sending money in seconds. It feels fast, easy, and safe. But what if the system you trust the most is also the one exposing you to the biggest risks? Behind the convenience of cashless transactions, there's a growing wave of cyber scams, data leaks, and silent financial losses that most people never see coming. In this video, we're going to uncover what really happens to your money in the digital world and why understanding this now could save you from serious trouble later. Why sitting is slowly killing you, the crucial role of physical activity for lifelong health. In every corner of the world, people are sitting more and moving less. In offices, classrooms, cars, buses, and homes, sedentary behavior has become the default human posture. Yet mounting evidence from decades of research suggests that sitting for prolonged periods is not merely a benign lifestyle choice, it is a direct contributor to deteriorating health, weakened metabolic function, increased risk of chronic diseases, and shortened lifespan. The danger is not just the absence of exercise, it is the presence of chronic physical inactivity. Physical activity, the consistent use of muscles to expel energy, is a natural biological requirement shaped by millions of years of human evolution. Our ancestors did not sit in chairs for hours. They walked, ran, climbed, lifted, carried, and performed physically demanding tasks simply to survive. Their bodies adapted to movement. Today's sedentary lifestyles, driven by technological convenience, industrialization, and urban infrastructure, have created a mismatch between human biology and daily behavior, a mismatch that is manifesting in a global health crisis. The World Health Organization, the leading global public health authority, has repeatedly identified physical inactivity as one of the top risk factors for non-communicable diseases worldwide. Physical inactivity contributes to heart disease, type 2 diabetes, obesity, certain cancers, mental health disorders, and premature death, and it places immense strain on healthcare systems, economies, and families. Despite overwhelming scientific evidence of the benefits of physical activity, billions of people remain insufficiently active, often unaware of how profoundly movement, or the lack of it, influences their bodies, minds, and longevity. This comprehensive article explores the biological mechanisms of physical activity, the health consequences of inactivity, the global scale of the inactivity crises, practical approaches to increasing daily movement, policy and environmental influences, and the lifelong benefits of consistent activity. By the end, you will understand that physical activity is not optional. It is a foundational pillar of human health, a principle as essential as food, water, and sleep. Physical activity is defined as any bodily movement produced by skeletal muscles that expends energy. This broad definition encompasses everything from purposeful workouts to daily movements that many people overlook. While structured exercise, such as gym workouts, running, or fitness classes, is a beneficial form of physical activity, it represents only a portion of the movement spectrum. Other forms include walking, cycling, climbing stairs, carrying groceries, household chores, gardening, active play with children or pets, occupational movements, manual labor, standing work. The key factor is the engagement of muscles in consistent movement that increases energy expenditure above resting levels. Physical activity occurs on a spectrum of intensity levels. Light intensity activities such as casual walking or gentle household tasks elevate energy expenditure above sitting but do not drastically increase heart rate. Moderate intensity activities such as brisk walking, cycling at a comfortable pace, or dancing produce noticeable increases in heart rate and breathing but allow conversation. Vigorous intensity activities such as running, high-intensity interval training, sports, or uphill cycling significantly elevate heart rate, breathing, and exertion. All levels of movement contribute to health, and even small increases in activity produce measurable benefits. Importantly, movement does not need to be intense to be impactful. Consistency across time is the critical factor. From an evolutionary perspective, humans are designed to move. For hundreds of thousands of years, survival depended on sustained motion. Finding food, shelter, water, safety, and social cooperation required walking, carrying, climbing, running, and lifting. The modern environment, characterized by prolonged sitting, mechanized transportation, and desk-dominant occupations, represents a dramatic departure from the conditions under which our bodies evolved. Our physiology, particularly our cardiovascular, muscular, metabolic, and neurological systems, is optimized for activity, not inactivity. When movement is minimized, the body enters a state of metabolic downregulation. Muscles atrophy, circulation slows, blood sugar regulation weakens, fat accumulates, and critical systems lose resilience. In contrast, even modest increases in daily movement produce robust improvements in metabolic control, cardiovascular regulation, immune function, mood stability, cognitive health, and overall longevity. These effects occur not only in elite athletes, but in ordinary people whose daily lives include frequent, consistent movement. Physical inactivity has reached epidemic proportions globally. According to estimates by the World Health Organization, approximately 31% of adults worldwide do not meet recommended activity levels, and a staggering 81% of adolescents are insufficiently active. These patterns are not confined to high-income countries. They are rising across low- and middle-income nations as urbanization, mechanization, and screen-based lifestyles spread. The inactivity crisis is not simply a personal health issue, it is a public health emergency. Sedentary lifestyles contribute to the global rise of non-communicable diseases, NCDs, including heart disease, diabetes, cancer, and chronic lung disease, which collectively account for more than 70% of deaths worldwide. Physical inactivity is recognized as a leading modifiable risk factor for these conditions. The causes of global inactivity are multifaceted. Urban planning that prioritizes vehicles over pedestrians, lack of access to safe parks and recreational spaces, work environments dominated by screens and seating, cultural norms that undervalue movement, and socioeconomic barriers to recreational activity all converge to suppress physical activity levels across populations. Technology, while providing convenience and efficiency, has inadvertently reduced daily movement. Elevators replace stairs. Remote work reduces walking, and streaming entertainment encourages prolonged sitting. The consequences extend beyond health. Economically, sedentary lifestyles are estimated to contribute to hundreds of billions of dollars in healthcare costs and productivity losses over the coming decades. Socially, communities with limited access to movement-friendly environments experience higher rates of obesity, mental health challenges, and reduced quality of life.